So our next speaker is Trisha Fallon. Trisha is a member of the National Steering Group for Enhancing Engagement, and she brings her considerable insight and lived experience perspective to the group. So welcome, Trisha.
Hi, good morning everybody, and thanks for the invitation to speak. I'm going to make eye contact with as many people as I can now, because after this it's head down. I'm reading from the script so that I don't go off and I don't forget anything. So again, my name is Trisha. I'm a service user and have been a service user for several years now, and in hindsight ought to have accessed services way before that, but one does what one can when one can. I've experienced crippling depression and anxiety for as long as I can remember. I have had CBT, sessions with grief and other counsellors, and at varying times medication. I'm grateful to live in a country where lack of finances did not preclude me from being able to access these services. I was, however, unhappy overall with the quality of the services, and an experience I had with one particular mental health professional is what led me to become involved with my local forum in the Sligo-Leitrim area. I attended my first forum meeting not really knowing what to expect, but sure that I wanted to have my voice heard. I wanted my voice heard and my experiences to count for something. More to the point, what I really wanted was to ensure that what I experienced would not be experienced by somebody else in the future if I could help it. Attending forum meetings and connecting with other service users and family members of service users has been an empowering experience for me. As chair of Sligo-Leitrim Local Forum, I feel privileged to carry the voices of fellow forum members to the wider forum of CHO and area management teams, and more recently to the arena of the National Steering Group of the Enhancing Engagement Project, which is driven clearly, concisely and very productively by Jessica, and I'm always in awe of her talents. Engagement. I see the role of engagement as being the bridge between them and us, and sad to say there is still an element of them and us in relation to mental health. So I see it as them being the HSE and us being service users, family members and carers. I see engagement as being the mechanism that takes all the research, all the surveys, all the innovation and best practice developments and aligns it with the hopes and expressed needs of those of us who are trying to live our best lives and to live the best way we can and manage our mental health at the same time. To me, engagement means including and empowering community. It means taking the catchy sound bites such as nothing about us, without us, and turning them into a concrete reality at community level. It means taking all the glossy policy documents and brochures with the carefully crafted words and phrases such as service, user-centric, etc., and actually breathing life into those words. On previous occasions, I've heard Michael Ryan speak about seeing mental health engagement and recovery as being a loop. He wants to turn mental health engagement recovery into a functioning team locally. When I heard him speak those words spoke directly to my heart, because I fully believe with all my heart that meaningful alignment of service providers and service users through co-production is what will turn a dysfunctional system into not only a functioning one, but a successful one. I've been asked if, as part of the National Enhancing Engagement Steering Group, I feel heard. The answer to that question is yes, I feel heard within the group. I see good people being volunteers and paid HSE employees. I feel heard within the group. I see good people with the overarching hope of helping people in distress. I see people with an obvious willingness to try change, to go beyond what has really not worked long term before now. I cannot say, though, that at the highest level of operations, and by that I mean the policy deciders, the people who actually say aye, yes or no at the end of the day, I cannot say that those good people that I just mentioned are being heard. From my observations, recovery seems to resent or doesn't accept as relevant and most certainly not equal engagement. I refuse to give up hope, though, that real and meaningful change can and will be brought about through continuing to use our collective voices. As a service user with a lot of hard-gained lived experience, I see that others, such as I, via the mechanism of one of the 5 pillars, local fora, are the bridge to them. I see that co-production and coexistence in the alignment of engagement and recovery is what can ultimately lead to a service, an overall mental health service that is fit for purpose and which works. Earlier this year, submissions were requested in relation to best practice in engagement, and at the time, I remember one of my thoughts was, oh, here we go again. Ask the questions, what do you want, what do you need? We've all answered those questions before. However, the request was put out, the response to that call was high, data was extracted, compiled by Jessica, and I am heartened to see that input being brought to life in the form of today's conference. It's an encouraging step towards Michael's aspiration of a functioning team at a local level. Every one of us here today, service users and employees alike, every one of us here today can and ought to have a part to play in engagement, in recovery, in helping people in distress throughout the mental health services. And I encourage all of us, each and every one of us here today, to meet each other in hope, trust, and open dialogue. Thank you for listening.